What do you do for varicose veins? Hello and welcome to another edition of the Ask Dr. Pickel Show. And today we're going to talk about varicose veins and some options, some things that potentially can be done and kind of why these can happen in the first place. So let's dive right in with that. All right. So varicose veins. In fact, let's make that a little bigger. So the thing is, here's what happens is in our leg, I know this is kind of a crude drawing here, but in our leg, everybody's leg has veins in them, all these different veins. And some of these veins are more superficial, meaning they're more towards the surface of the skin. And some of these veins actually go within our muscles and different areas there. And those are your deep veins. So those are kind of these two types of veins. Now, within the vein, I've kind of blew it up just a little here, like we were looking through a magnifying glass or a microscope. So these veins, they have valves in them. That's what these little blue lines are. They're valves. And those valves open and close because as blood flows up, remember, veins are returning blood back to your heart, whereas arteries push blood back to your body. So as veins are returning blood, they're kind of doing it against gravity. So these valves keep it from going backwards. We want that flow to keep going this direction. And if those valves are incompetent, if those valves are failing due to other reasons, which we'll talk about, then they become leaky and that blood starts to go backwards, which is not good because then it's being driven down and starts to pool. It starts to just kind of hang out in there. And the problem is blood hanging out, not a good thing. That can create all kinds of problems. We need it to be pumped. We need to be refreshed with more oxygen and nutrients and come back around to do its job. Otherwise, it kind of gets stale in there and that can create some other conditions. So we don't want that blood pooling. And then what can happen is the veins can become leaky and the blood can escape through the veins into our skin, and that can create other problems too. So one thing that can cause this is called venous hypertension. So if the tension inside here, let's say you already have hypertension. What is hypertension? High blood pressure. So if your blood pressure is high, that not only puts more pressure on your arteries, but also on your veins. So this can allow those expansion of the veins, the valves start to fail. We're going to have some problems there. Now, another one is if the valves themselves start to break down, and there's reasons that can occur. Things that we do, which again, we'll get to here in a minute, that can weaken those valves also. And a big one here is inflammation. So anytime there's inflammation in your body, especially chronic inflammation, I mean, acute inflammation is like, hey, I just sprained my ankle. Yeah, that could create some trouble, maybe damage some veins. But if it's chronic inflammation, that's what's usually going to lead to, hey, it's there and these varicose veins are not going away. Now, usually the way this starts, there's kind of stages here of varicose veins occurring. Usually the first ones that'll occur are these little ones you'll start to see on the legs or other areas of the body. And these are called spider veins. And what happens is the veins aren't working too well, and the veins, the tissue that makes up the actual veins, need its own supply of blood and oxygen. So sometimes they'll actually start to cause more blood vessels to be formed around these areas to get more oxygen and nutrients in. And then we get, it's called neovascularization, growth of new blood vessels, and we start to get these spider veins. So then the next step is, now these veins start to expand. They start to become larger. They start to become ropey. And especially if they're the superficial veins, those are the ones you can see. And if they start to expand, now you can see them where it used to be, hey, I couldn't see these on my leg. But now you start to see them. They look bigger. And then what happens? Then they start to fill more with fluid. Remember, that fluid backs up. And if that fluid starts to back up in the vein expands. That fluid, the veins can't pump the fluid out. So then the fluid kind of starts to set in your ankles and your feet because gravity's pulling it down. So then we start to get edema and swelling. And you may say, as the day goes by, my ankles get bigger, my feet get bigger. And then once I lay down and go to sleep at night in the morning, it's better. You've changed gravity. You've changed the way that fluid has set. So this is not a good stage. And then if that fluid just sets there and some of these, the blood just pools, this can start to that fluid starts to seep into the skin again, and this can start to cause skin discoloration. And maybe you've seen more advanced uh, varicose veins issues, maybe especially in people who have diabetes over time. You look at their legs or feet and it's discolored. Yeah. And then what can also happen if that goes on long enough, the skin itself starts to change. It can become more roughened or calloused, or it just doesn't seem like normal skin should. And then also that skin can start to break open or ulcerate, which can lead to infection. So we don't want that either. So not a good thing, and not a good road to go down. So what do you do here? Well, let's talk a few more things about risk factors. What can lead to this in the first place? Number one, age. So as we get older, yeah, we lose some competency of our veins. They maybe don't work as good because they're getting age. Now, we can't blame everything on age though, because why do some people as they get older, they don't have any problem at all? So you can't blame it all on that, but it depends on how you treat your body over time. Now, we do see more varicose veins in females, definitely. And then the other thing that has a giant influence is hormones. I'm having a pencil problem here. All right. So these hormones, birth control pills or hormone replacement therapy, these bring extra estrogens into the system. And it's well known in the research that increased estrogens are a major factor, and it's these endogenous estrogens. It's not the estrogens that the ovaries and uterus make, not the estrogens that your adrenal glands eventually turn a hormone into, that happens in menopause. But these are usually when people are taking hormone replacement therapy or, again, the birth control pills. And then, yeah, if you have diabetes, that increases your risk, because then you get a lot more blood vessel breakdown. Blood sugar is storing in tissues it shouldn't, and we start to get destruction. And also there's nerves that go to these areas that can get damaged. And then, yeah, if you have a sedentary lifestyle, just think about it. Most people are at computers all day, adults and children. This sedentary lifestyle has big effects, because it's actually our muscles as they contract in our legs that help to pump those veins and keep that circulation going. So very important. Smokers, if you're a smoker, yeah, you put yourself at risk for a lot of things, but number one, it's going to increase collagen, the non-renewal of collagen, and also other nutrients from your body are going to be robbed, especially antioxidants. Just bad stuff. Genetics, yeah, there can be some genetic factors, especially that increase risk of inflammation and other issues there. And then too, if you say, hey, I've got a bunch of family members and they all had varicose veins, yeah, maybe a little increased risk there. Pregnancy, yeah, if you're pregnant, this changes blood flow. There's a few, especially if you've had multiple pregnancies, more than one, really, you can get the increased risk for varicose veins. And then standing a lot, not just being over the computer a lot, but if you're at a job where you're standing, let's say at a counter, or you're standing, or you do some kind of work where you just stand all day on hard floors, yeah, not good. This is going to actually lead to it also. And then high blood pressure. Yeah, if you already have hypertension or high blood pressure, you've just increased your risk. So what are the typical symptoms that go along with this? Itching, swelling, burning, cramping, skin color changes on the legs or feet, and can be other areas. And then eventually you can get some ulcerations. We don't want those. So what do they usually do about it in your conventional medicine? Well, maybe some endovenous ablation. This is where they'll either use a laser or radio frequency and just burn those veins out, or the sclerotherapy. And then that's where they'll inject into the vein, and that'll help kind of maybe change it. And then the surgical stripping, which is a little more advanced, where they strip those veins out. All right. So what do you do? Number one, we've got to decrease those excess estrogens. We got to if you are doing some estrogen, whether it be birth control or hormone replacement, something to look into as a possibility you may need to change. Also, taking DIM, and watch my other video on DIM. I'll post it on the screen at the end of this video, but that has a profound effect on getting rid of those endogenous estrogens, or helping prevent the conversion of your estrogen into kind of the bad kind, to keep it towards the good kind, which is explained more in that video. And then B vitamins, which are going to do a lot of great things, but I'll actually help your liver to get rid of these extra estrogens better too. And then, and if you're taking birth control, you should already be on B vitamins anyway. And then inflammation. So you've got to get inflammation under control. I mean, this is destruction in the body, and this is going to affect so many other things besides your veins. The veins are a problem, but if you're inflamed, you got a lot more going on. So you may need to change your diet. You may need to get rid of infections or heavy metals or chemicals. Some great things that people do sometimes are fasting, intermittent fasting. That really helps to get their blood sugar under control, get down inflammation, and increase water intake. You got to have plenty of water or your body starts to hold more water, and that can increase swelling. Water is a natural diuretic. Now, there's some herbs that tend to work really well with varicose veins and spider veins too. The top one is called horse chestnut, and it has this ingredient called lessen or something. I don't know how to pronounce it. But what does horse chestnut do? It can decrease pain. It can increase circulation, decrease swelling. It can increase the health of the vein itself. So great botanical for that. Ginger root, which we have another video on ginger too, and maybe I'll put it up at the end. Anti-inflammatory, anticoagulation, increased circulation. Yeah, good stuff with ginger root. Then witch hazel. Witch hazel is really interesting stuff. I think everybody should have some witch hazel at home, and some people haven't even heard of it. But this tightens the stretched veins. It's actually called an astringent, and it increases vessel strength, decreases pain in the blood vessels. And then there's another one called diosmin. And this shrinks those problem vessels and helps to increase blood flow. A lot of people like that one. The hesperidin, I like that one because that makes the blood vessel stronger. It makes it less fragile because these blood vessels are breaking open. They're becoming more permeable and fluids leaking out of them. So we need those vessels and valves to be strong. And of course, it also decreases the vessels releasing blood out into your system, which leads to some of the discoloration and the other things. Though a number one on top of this, though, is exercise. You've got to get those muscles strong. Now, exercise isn't, hey, I was at work all day, that's enough exercise for me. No, work and exercise. If I go out and dig ditches, that's not exercise. So again, it's got to be real exercise. And there's exercises that are targeted more for your legs. In fact, you can even look up, hey, exercises for varicose veins, and you'll find some out there. So yeah, any type of things with the legs, walking, bicycle, and this doesn't long. This is like, hey, I'm going for a 20-minute walk. In fact, there's another video we did on HIIT, which is the best way to exercise, and that's just these intervals. So I would also look for that. And then bicycling, leg lifts, lunges, I wrote leg lifts twice. Yes. So there's different exercises that can be done, but a lot of them involve the legs, contracting and relaxing those muscles so you get those veins working the way they should. All right. So hopefully everybody got some good information out of this on varicose veins. And again, before you try anything, you should always talk to your doctor first. Make sure there's none of these that interfere with medications. And, some veins need to be looked at a little further with some further diagnostics to make sure you don't have some kind of clot or deep vein thrombosis or something that's, affecting your circulation in there too. So again, always look at these things with, what could be causing this, or is there something else that we need to look at? So, all right. Well, hopefully everybody got some great information. God bless, and I'll see you on the next video.